Also working new developments on the local response to the Ebola outbreak. Things back to normal at a local hospital after an Ebola scare turned out to be nothing more than a false alarm.
Officials tell us a patient arrived at Westerly Hospital late Saturday night with flu-like symptoms and an unclear travel history. Out of caution, staff put on protective gear and placed the patient in isolation. But after determining the patient was not at risk for the deadly virus that is, they were released.
Meanwhile, the state nurses union will release the results today on how prepared Rhode Island is for this virus. Eyewitness News reporter Brian Yacono joining us in studio now with more.
Yeah, good morning. In just a few hours, in fact, we do expect to get our first real gauge of Rhode Island's ability to respond to Ebola. The regional healthcare union that represents more than 6,000 healthcare professionals, from nurses to support staff, conducted the survey just over the last week. Now, this is an internal survey to get a real feel for what's happening within our local healthcare system. And their goal, they say, is to get some action from state leaders and hospital administrators to implement universal safety measures to protect both caregivers and the general public. Meanwhile, the Department of Health points out that people with the disease not contagious until they show symptoms. And the Rhode Island State Nurses Association tells Eyewitness News that members have had ongoing training. This weekend, as we mentioned, safety protocols used when a patient arrived at Westerly Hospital with flu-like symptoms. That patient later said to not be at risk for having the Ebola virus. Now, the union's president explains there is a disconnect between what political leaders say and the real concerns of union members. In the studio, Brian Yacono, Eyewitness News.
Our coverage of the Ebola outbreak and our local response continues on air and online. Go to our website for important information about the virus, including symptoms, treatment, risk of exposure, and prevention. It's all online. Just go to WPRI.com.